Welcome back to Autism Today. Our next guest is Dr. Eileen Hopkins, and Dr. Hopkins is the Deputy Executive Director at the Eden 2 programs. She and I have worked together there for over 20 years. I consider her one of the most knowledgeable people about drugs and biomedical research and various other things. So, you know, I'm going to ask you the $50,000 question, Eileen. Do we know the cause of autism?
Short answer, no. Unfortunately,
okay.
we don't. And we all wish very much that we did. But we do know a lot. And we know a lot more now than we knew years ago about different factors that may contribute to autism. We know there's a strong genetic component. Twin studies show that monozygotic twins, identical twins, have much higher rates of concordance, where both twins would have autism, than dizygotic or fraternal twins. We know that multiple genes may contribute to autism. There's a possibility that some cases of autism may be caused by a single gene, but the likelihood is that multiple genes are contributing. And additionally, there's a strong likelihood of an environmental component as well. So there may be cases, when you think about genes, you can have a single gene that, or genetic difference that has high penetrance. Basically, on its own, it can cause a disorder like autism.
Right.
Or you can have genes that maybe create a susceptibility to autism, and then in combination with other genetic conditions or environmental conditions result in the disorder.
Right. So I read an article recently about the dizygotic twins and how there's a higher rate of autism than you would expect. And so that kind of led to the idea that the environment in the womb actually played a role?
Yeah, that's a very recent publication from data, I believe from California, which was a large-scale study. And studies like that have been done before, where we looked at differences in the monozygotic versus dizygotic twin relative concordance ratios. But this study showed a much higher amount of autism concordance among fraternal twins who aren't genetically identical than you would expect. And they had a higher level of concordance than brothers, siblings, sisters. So it suggests that there may be, whether it's in the womb, whether it's in immediately after birth, we don't know.
Right.
The timing, is it early in development, middle, late development, post-birth? But there is a suggestion from that study that environmental component may be stronger than we initially thought.
So if I have a child with autism or a cousin with autism or an aunt with autism, I'm at greater risk, I guess, because of the genetic component of having another child on the spectrum?
I would say we don't know. So there may be cases where the genetics are hereditary in the sense that the gene responsible is present in the parents and family members, and there are probably also cases where it's the changes are de novo. They occur for the first time. Something happens in the individual. So it's not a clear answer. Okay,
so let's talk a little bit now about biomedical treatment, because you know, as we spoke with Peter on the internet, you're going to go and you're going to see things ranging from, you know, tarantula blood all the way up to diets and vitamins. What is real and what's just out there?
Okay. Well, what's real is what Dr. Gerhardt referenced as early intensive applied behavior analysis. You know, people don't think of ABA as a biomedical treatment, but in a sense it is. It's changing people's brains. It's intervening at an early level of neuronal plasticity where you can make meaningful changes. And we've seen, you've seen through your years of experience, the way that children can change with really effective, intensive early treatment. But there's a lot of stuff out there that maybe seems promising in the sense of a magic bullet, you know, but most of the time doesn't pan out, and so far hasn't. So, and in fact, some kids are subjected to treatments that could potentially be dangerous.
Chelation therapy.
Chelation was big back in, I guess, throughout the 2000s, and there's no evidence supporting its effectiveness in helping kids with autism or adults with autism. The thought was that there's heavy metals that can be chelated or taken out of the blood through administration of these drugs, and they don't work. There's no evidence.
And I think I read that a child with autism actually died.
Yeah, that's the the bigger edge of the risk is that some of the treatments that are being marketed to families of kids with autism are not only not effective, some of them aren't even safe.
Gluten-free, casein-free diet.
Gluten-free, casein-free diet is something that seems safe, changing, what foods are offered to children in the hope that if there's some sort of gluten sensitivity or casein sensitivity, there'll be an inflammatory process that if you stop it, the children will do better. Comprehensive meta-analysis of research, 15 different studies showed that the studies that are out there to support it are methodologically flawed, and some actually don't support it. So overall, the finding is there's not clear evidence for its efficacy for kids with autism,
right.
and there are potential consequences in terms of diversion of treatment resources, cost for families, stigmatization, kids who have to eat different food than the peers that they're in school with, and even decreased cortical bone density. So, sometimes things seem benign and aren't.
Yeah, it's very difficult because I know we have a lot of families who come to us and say, I want my child on the gluten-free, casein-free diet because Jenny McCarthy said it will cure my child. Right. And it's difficult because there are these potential side effects.
Yeah, and if a child has celiac disease in addition to autism, or if they have a severe food issue that's diagnosed medically,
right.
Then there may be a role for a certain subset of kids that happen to have autism.
Sure.
But it's not a treatment for autism. The only caveat to that I would say is that if a parent did try one of those diets for whatever reason, despite the lack of support, only if they saw an immediate, acute, really significant change in the
right.
child's presentation and functioning should a diet like that really be continued.
And work with the school. I mean, if they came to our school, right, we could evaluate whether or not there were changes in the child after the diet was implemented, right, and then maybe stop the diet for a month or two, and you see.
Absolutely.
So, okay, let me ask you now about another big area in the sort of biomedical arena, which is medications. I know that especially as a lot of our participants enter adolescence and adulthood, many of them are on medications, but even some young children are. Where is the research right now on medications and autism?
Okay. First, there are no medications to cure autism. There are no medications to treat autism, the disorder per se. There are 2 medications that are approved by the FDA for treatment of some symptoms associated with autism for some children and adults with autism. But those drugs, and those are Abilify and Risperdal, they're not going to be needed or appropriate for a lot of kids and adults with autism, and they're also they come with a lot of potential side effects. And
right.
many times with these medications, the full side effect profiles aren't known immediately. So initial side effects reported may be weight gain or fatigue, or and then years later we find out, and this is the case in these neuroleptic drugs, some of them cause, in addition to extrapyramidal symptoms, can cause elevated blood sugar, can cause elevated prolactin levels, which can cause breast tissue growth, and also can cause early onset diabetes. So,
right.
Drugs have a role in helping some symptoms for some people, but the decisions have to be really made carefully.
Right, right. Because I also have heard this concept that oftentimes there's a paradoxical effect.
Right.
Can you explain what paradoxical effect means?
It just basically means it's the opposite to the effect that we intended or hoped that we would have. And some children and adults with autism respond to atypical doses of meds.
Right.
So they may do better with a dose that's much below what's typically prescribed, or they may have the absolute opposite reaction. So